Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to talk about is actually a very interesting one. It is understanding the link between obesity and breathing difficulties. What used to happen was when a patient who was morbidly obese used to walk in my clinic and used to be really breathless, I used to always wonder there must be something wrong either with his heart or his lungs. So I used to make sure that I check his heart and lungs thoroughly with, first of all, comprehensive health history, then always talking about, dyspnea at rest, dyspnea at an angle, dyspnea while exercising. Dyspnea means breathlessness. And then, so first of all, comprehensive health history, exploring all the components of heart and lungs. So asking about smoking and asking about all the other questions that could explore that whether it's heart related or lung related. Then used to do blood tests accordingly, scans accordingly, and then if needed, specialist referral accordingly to either the cardiologist, most probably, and if found anything in lungs, then to the respiratory physician, just to make sure that this breathlessness is if it's a heart cause, we can address the heart cause. If it's a lung cause, we can address the lung cause. And if it's both of them, which can also very much be possible, because eventually lung issues can cause heart issues and heart issues can cause lung issues because they are both connected through a system, which I will explain one other day. It's a physiological system, pulmonary, venous and arterial system. So so I used to make sure that both heart and lungs are okay. But now I have come to know that there is a direct link between obesity itself and breathing difficulties. So your heart could be okay, your lungs could be okay, but because you are morbidly obese, which is with a body mass index of more than 40 or more of the central obesity again, or of the metabolic syndrome in which you have high blood pressure, high sugar levels, high cholesterol and obesity, then the obesity itself can cause breathlessness. So that was a big thing for me to learn. And then, do you know that obesity can also cause heart failure? And obesity itself, you don't have to have osteoarthritis, you don't have to have other degenerative diseases. Obesity itself can cause large joints pain like hip and knee pain. So if you are large, in size, if you are obese, see, I'm not fat shaming here. I can never fat shame anyone because I was a big person all my life. That's why I had to do the sleeve gastrectomy done back in 2017. I had to do the weight loss surgery done because my knees were giving away and I could not walk properly. And since I have lost half of my weight, my knees are still bad, but they are not, as they are 80% better actually. If I can't put it into words, I can put it into maths and can tell you that at least 80% better. So there is obesity-induced breathlessness, there is obesity-induced heart failure, which can again cause breathlessness, and there is obesity-induced hip and knee pain. So I'll talk about everything, but today I'm gonna very lightly touch upon understanding the link between obesity and breathing difficulties. There is an article at Medical International Research that I would like to read with you. Is there a relationship between obesity and breathing difficulties? Apparently there is, and it is not necessarily related to lack of physical activity. Together with an increased risk for conditions like diabetes and cardiovascular diseases, excessive accumulation of fat in your body may also lead to shortness of breath or dyspnea, which may be an indicator for underlying inflammations or changes in lung function. So, excess accumulation of fat around the chest area can actually lead to shortness of breath because what it does is it causes underlying inflammation and changes in lung function. There are two ways obesity can affect your lung function: by direct restriction. If there is a lot of fat around your lungs, of course, there is a direct restriction, or there is a direct restricting procedure, or because of indirect processes. So directly by restricting the lung capacity, or because of indirect processes, which I will explain later. Shortness of breath due to excessive body weight is usually associated with central obesity again. In this case, fat tends to deposit especially around the chest and abdomen, creating a so-called apple-shaped body type Unlike peripheral obesity, where most of the fat can be found around the hips, thighs, and limbs, creating a pear-shaped body. Here we are not talking about pear-shaped body. Here we are talking about apple-shaped body type, in which there is central around the abdomen and around the chest there is more fat. Fat deposits in your neck, chest, and abdomen can act as obstacle for your lungs to breathe, for your lungs to expand, for your lungs, restricting their ability to expand and causing alteration in breathing patterns. So see, it's very easy to understand. If there is a lot of visceral fat in your chest and it's restricting your lungs, of course it cannot expand and you cannot breathe normally. Besides, central obesity can also impact hormone production, creating mild inflammations that can play a role in the development of metabolic syndrome and sleep-disordered breathing or sleep apnea. So again, obesity can cause sleep apnea. The neck obesity, the neck circumference is also very important in measuring for sleep apnea. So obesity can restrict the lungs. Obesity can cause sleep apnea as well. Then there is something called severe obesity related shortness of breath, can also be due to a condition known as obesity hypoventilation syndrome. What is obesity hypoventilation syndrome? We'll continue with it tomorrow.